as a patient, you really have very few objective ways to evaluate hospitals or physicians. It's something of a well-kept secret locally. This was not the first place I went.
It's like a hidden gem, isn't it?
It's like a hidden gem. Well, the first place I went misdiagnosed me. And,
yes.
So had I merely relied upon their diagnosis, you'd be looking at an empty chair here today. The one thing that is evident is the difference in the culture that exists. Everything's different. The attitude is different. The culture is different. It's immediately evident that, okay, this is a world-class facility, and that's the level at which everything operates.
This is the map of US, and there are only 19 cancer centers in the country that are a part of NCCN. NCCN stands for National Comprehensive Cancer Network. What that means is doctors from these 19 centers write the guidelines for cancer care, which are updated every year. And these guidelines are followed across the country. And when I travel across the world, I see they're followed across the world as well. So when you come to someone like me or my colleagues at the Fred and Pamela Buffett Cancer Center, you're probably talking to someone that has written those guidelines. And if you look at the company that we're in, there's Sloan Kettering there, there's Johns Hopkins there, there's MD Anderson there, and just within the last week or two, Yale joined this network, and the place where you were thinking of driving up north, Mayo Clinic in Rochester, joined this network just a few weeks ago.
Okay.
It's a hidden gem, as you said, and you really don't need to go anywhere. If you come here, you're getting the latest care. And that's why when I see patients, I may have told this to you as well, on whichever day I see them, on today, the current recommendations are, because we are people from these centers that write the guidelines. When they find out that they have cancer, the initial shock is it's a death sentence.
Yes.
And once you get over that, the only names that come to you are these names in different parts of the country.
Yes.
But the hope is that as we move forward, we keep telling you that you come to the Fred and Pamela Buffett Cancer Center, you're going to get the best care. And it's not for the sake of bragging, but it's for the sake of letting the good citizens of the state know that you get the same quality care here.
The ability to have that kind of world-class treatment locally and not have to travel and not have to live in a Holiday Inn for 1,000 miles away and all those things is huge. If you had cancer, where would you go? And that's really kind of a litmus test. The answer I was given by people I respect highly was Med Center.
We have one of the large group of fellowship-trained surgical oncologists in the region. And what we mean by fellowship-trained is that after we do our regular training, we spent an extra few years just taking care of patients with cancer and nothing else. I don't think many people in the city or the region or the state realize that we have one of the larger groups of fellowship-trained cancer surgeons. And we also do state-of-the-art research here. In fact, if you look at it, for some cancers, we probably have some of the most accomplished researchers in the country, if not maybe the world. When you come to a cancer center like that, you're getting the best cancer care in the country. If you've got any type of cancer, you can get world-class care right in your backyard without having to travel anywhere, and you'll get it with nice midwestern hospitality.